Hi, I'm Mark Wish, a cardiac electrophysiologist and director of the Inova Fairfax Electrophysiology Lab. For the next few minutes, I'm going to discuss the characteristics and factors that may increase a patient's risk of developing atrial fibrillation. Addressing and treating these underlying risk factors can reduce your likelihood of developing repeated episodes of atrial fibrillation. Modifiable lifestyle risk factors. Many of our modern lifestyle behaviors increase the risk of developing atrial fibrillation. This may at least partially explain why we are seeing the frequency of atrial fibrillation grow faster than many other cardiovascular diseases. The good news is that changing your lifestyle to reduce the burden of these risk factors can reduce the burden of atrial fibrillation and the risks that go along with it. One of the goals of the Inova Atrial Fibrillation Center is to bring all of the resources you need to address your underlying atrial fibrillation risk factors to you during a single appointment. The purpose of the surveys you were asked to complete as part of your pre-visit paperwork is to help us schedule appointments with the specialists who are experts in handling your atrial fibrillation risk factors. Smoking. Smoking increases the risks of many forms of heart disease, including atrial fibrillation. Smokers have almost twice the risk of developing atrial fibrillation compared to non-smokers. Smokers also have a higher risk of stroke with atrial fibrillation than non-smokers. Stopping smoking can reduce the burden of atrial fibrillation and the risk of stroke from atrial fibrillation. Good resources are available to help you stop smoking if you are ready to quit. Alcohol. Heavy drinking is associated with a higher risk of developing atrial fibrillation. Moderation is the key. If you notice that you are more likely to get palpitations after drinking alcohol, then decrease or eliminate consumption. Otherwise, a drink or two is okay if not associated with events. Caffeine. For a long time, we taught patients to avoid caffeine if they were experiencing atrial fibrillation. However, more recent evidence has made the connection between caffeine intake and atrial fibrillation less clear. Again, moderation is the key. If you notice that one too many lattes or cappuccinos triggers palpitations, cut down on the caffeine. Find something else to drink. Weight. Being overweight or obese increases the risk of developing atrial fibrillation, and the success of medications and procedures for controlling atrial fibrillation is reduced among overweight or obese patients. We determine if patients are overweight using a scale known as the Body Mass Index, or BMI, which adjusts the weight for the patient's height. For people with BMI over 30, weight reduction is an important part of the overall strategy to treat atrial fibrillation. In addition, weight can be so high that catheter procedures for atrial fibrillation become risky and should be deferred until weight is down. Controlled weight is therefore part of the overall approach to atrial fibrillation management. Sleep apnea. Sleep apnea is a condition where patients stop breathing for longer than normal during sleep. This can result in increased burden of atrial fibrillation and make atrial fibrillation more difficult to treat. It is commonly associated with snoring and a sense of sleepiness during daytime hours. Treatment of sleep apnea can help us reduce the burden of atrial fibrillation when combined with medications or ablation procedures. Stress, anxiety, and depression. Stress, anxiety, and depression can increase the likelihood of developing atrial fibrillation and can reduce quality of life. 30 to 50% of patients with atrial fibrillation experience stress or depression, and treatment can improve outcomes. Diabetes and hypertension. Other medical illnesses, especially hypertension or high blood pressure and diabetes, increase your chances of developing atrial fibrillation. Good blood pressure, control and good blood sugar control are important to maximize your likelihood of maintaining normal rhythm. Non-modifiable risk factors. Age, unfortunately, getting older adds significant risk of developing atrial fibrillation. By the time patients reach their 60s, 3 to 5% will have experienced atrial fibrillation. By the time they reach their 80s, up to 20% will have experienced atrial fibrillation. Structural heart disease. This can take the form of an enlarged or weakened heart, even in the absence of clinical heart failure. Valve problems can increase the size and stretch of the atria, which can increase the risk of atrial fibrillation. Some patients have an enlarged atrium for reasons that may not be obvious, and this can predispose to atrial fib. Family history, genetics. If someone in the family has had atrial fibrillation, you have a higher risk of developing atrial fibrillation too. Scientists have found a total of 138 different genes with mutations that raise the risk of atrial fibrillation. However, no specific therapies are targeted at gene mutations, and patients with inherited forms of atrial fibrillation are treated the same way as people who developed atrial fib for other reasons. There was a study in 2020 that looked at the risk factors for recurrent atrial fibrillation 10 years after a successful ablation and no AFib. The biggest risk factors for late recurrence of AFib were obesity, poorly controlled high blood pressure, and poorly controlled diabetes. This study points out that risk factor modification should not end after a successful therapy.